A lot of people will experience pain passing urine, and this is actually a symptom, and the term for the symptom is dysuria. And there are so many different causes as to why an individual will experience pain when passing urine. And in today's video, I'm going to go through with you the top 5 reasons why you may be experiencing pain when passing urine. So let's get into it. Hello everyone, my name is Dr. Uyiosa, and this channel is on all things health, business and finance. The first cause is chlamydia, one of the most common sexually transmitted infections in the UK, and it is passed from one individual to the next when there is unprotected sexual intercourse. It's important to note that chlamydia can actually be asymptomatic, and by asymptomatic I basically mean that you can be infected by chlamydia but have zero symptoms. This is the case for 70% of females and roughly 30% of males. Now, in those individuals that do have symptoms, again the symptoms do vary from male to female. So we'll start with male first. Males may experience what we call discharge coming from the penis, and this is typically a clear colour. They may also notice that they have pain when passing urine and also pain around the back passage. Whereas in females, they will typically experience vaginal discharge, bleeding after sexual intercourse. Now, it's important to note that there are different ways in which an individual can contract chlamydia, and I'm going to go through them with you. So the first way is through unprotected oral, anal or vaginal sexual intercourse. The second way is if your genitals and your partner's genitals come in contact despite there being no penetration. And the third is if any infected vaginal or semen fluid gets into the eyes. If you think you have chlamydia, it's important that you get yourself checked out, and you can do this for free by going to a gum clinic, a health clinic or visiting your GP. But it's not something to worry about if you do have chlamydia. This is because it's typically treated with antibiotics, and there's 2 antibiotics that are our first line treatment. The first antibiotic that you could be given is called azithromycin, and the second is doxycycline. And the second cause is another sexually transmitted infection known as gonorrhea. And gonorrhea is caused by a bacteria which is pronounced as Neisseria gonorrhoeae. Gonorrhea can spread through oral, anal or vaginal sexual intercourse, and also through the sharing of sex toys. In 1 in 10 men who are infected with gonorrhea, they won't experience symptoms, and about roughly 50% of women who do have gonorrhea will also be asymptomatic. With those who do have symptoms, they will typically find that they have some discharge, and the discharge is pus-like and mucus-like all mixed together in one, and the medical term for that is mucopurulent discharge. I'll insert some pictures here and here for you to see what the type of discharge looks like. And the second key symptom is pain when passing urine. A course of antibiotics can be given to help clear it up, and in the UK the antibiotic of choice is ceftriaxone and ciprofloxacin. As you can see, a number of people who are infected with an STI do not have symptoms, and therefore may not know that they are infected and can therefore pass on this infection to the next person. It's super important that you get yourself checked out, and you can do this for free. On the NHS website there is a list of health clinics that you can go to or find in your local area, and these health clinics will offer tests, and if you are to visit a sexual health clinic, the information will not be disclosed to your GP unless you give permission for it to. The third cause is herpes. Unlike the other 2 conditions I've made reference to, herpes is actually caused by a virus known as the herpes simplex virus. Roughly 1/3 of individuals who are infected by herpes will experience symptoms at the time of initial infection. But the really interesting thing about herpes is it's actually a lifelong condition. Reason being, After the first initial infection, it actually lies dormant in the nerves, and over a period of time it will become reactivated again, and an individual will then have symptoms. Typically, herpes presents with blisters that then become painful ulcers around the anal genital area, and as a result of these ulcers, an individual will experience pain when passing urine and will also experience some discharge. If an individual is diagnosed with herpes, they will be given antivirals, and an example of an antiviral is acyclovir, and they'll also be given advice on how to manage their pain because herpes is really painful. The fourth cause is a UTI, and UTI stands for urinary tract infection. So in order for this to make sense, there are two important parts that I want you to remember. The first part is the bladder, and the bladder basically stores urine, and the second part is the urethra, and the urethra is connected to the bladder and allows urine to pass out of our body. And the reason why UTIs are super common is because some bacteria from our poo basically travels up the urethra and can cause infection in the urethra or in the bladder itself. And women actually have a shorter urethra in comparison to men, and therefore UTIs are more common in women than they are in men. So you're probably wondering, Dr. Uyiosa, what are the symptoms of a UTI? And I'm about to share them with you. So the first thing an individual may notice is that they are going to the toilet to pass urine more often, and this is known as increased frequency. The second is pain when passing urine, and the medical term for this is dysuria. The third is actually changes to the urine itself, so it may be more cloudy, it could smell bad, it may even have some blood in it. And the fourth symptom could be having pain in the lower part of the tummy. And the last is kidney stones. Kidney stones are basically stones that are formed either in the kidneys themselves or in the tube which connects the kidneys to the bladder, known as the ureter. Kidney stones are really common. In fact, 1 in 10 experience kidney stones in their lifetime. And I must admit, kidney stones are super painful, and they're typically caused by not drinking enough water. The second, if you're on any medication or if you have any medical conditions that cause the levels of certain substances in your urine to be higher than normal. Now, the body is really cool. If a kidney stone does develop, it will try to get rid of it. And it will do this by basically allowing the stone to follow the path in which your urine would typically flow. And that leads to some characteristic symptoms of a kidney stone. So some people will say that their pain moves from the side of their back to their groin area. It will be intermittent in nature. They may notice changes to how much they are passing urine or how frequently they're passing urine. They typically have a dull ache either on one side or both sides, depending on where the kidney stone is. And kidney stones can be treated. If they're small enough, they'll pass by themselves, and analgesia is given to the patient to make sure that they are comfortable through this process. But if the kidney stone is too big, then surgery is an option to help break down the stone so that the body can pass it a lot easier. I hope this video was useful. If it was, don't forget to like, comment and subscribe, and also don't forget to share this with someone who needs to know about the different causes of why you can get pain when passing urine. And I'll see you in my next video. Take care, Dr. Uyiosa.